On the outskirts of Kuala Lumpur, healthcare now arrives on wheels. This nurse has all the medical supplies she needs on her shoulders. 4 years ago, Mr. O had his second stroke. He's not able to move or eat on his own. So almost every day, a nurse bathes him and helps him to breathe better. Simple procedures that help him reduce the number of times he has to go to the hospital. But this mobile health service doesn't come cheap, some $2,000 a month for the O family. It's being paid for by insurance through Mr. O's former employer.
If we were to take my pension and my husband's pension, it would not have covered his expenses.
Still, taking care of Mr. O is a team effort. One of their daughters even quit her job to help. There are nursing homes in Malaysia, but this is a country rooted in traditional Asian values. Children and elderly parents live together, or at the very least, they look after each other. That's why the Malaysian government wants to expand mobile health services like this one, because by the year 2030, the number of elderly people in Malaysia will almost double to 15% of the population. And to cope with that, the government wants more companies like this one. It hopes this army of pink nurses and therapists can help ease its overcrowded hospitals while making profits from providing basic clinical care.
From my own personal experience managing my parents, my father was 95 years old, my mother was 80, and we had to take care of them. The chore of getting a hospital was the challenge, especially for my mother, who had respiratory problems. We have about 2.5 million Malaysians today above the age of 60, and there's a need to provide this service for them.
The company says it wants to bring down its prices even further. Families like the Lows are using their retirement savings for physiotherapy. Miss Low suffered a stroke and needs to relearn to use her right arm and leg. Like most Malaysians, people here still rely on their families when they get old. But times are changing, and where relatives start to leave gaps, businesses are stepping in. Jennifer Pak, BBC News, in Selangor State, Malaysia.